Hey there, and happy lunchtime on a Friday. My name is Julie Hirschberg. I am the owner-founder of Re+active Therapy and Wellness here in the Los Angeles area. The last time I hopped on, it was like 90 degrees. Today it's 70. This is like the perfect LA weather, I think. And always happy to join you here when I am in the midst of reading and learning, and particularly this happens a lot when I'm putting together some teaching that I'm doing, and we have a mini course coming up on dystonia in November, so just a month away. And by the way, we had a little snafu in our early bird for this dystonia course, so it's actually open for another day as an early bird. This is our mini course. Oh my gosh, Carter joined us. Nikia joined us. Hello and welcome. Thanks for joining me over lunch. So glad to see you. I love our community so much. But today I was actually reading an article, putting together some of the background for this dystonia course, and I've been updating the literature review that I've done on the pathophysiology, like what is some of the understanding that we know that might cause dystonia, and read this really great article that I just had to share. So thanks for joining me on a Friday to learn with me. And this is the title of the article. Like this title had me at hello. Brain connectivity, abnormalities, and treatment-induced restorations in patients with cervical dystonia. What a great title, and for sure is going to get any neuro PT really, really excited. And yeah, so Nikia's commenting already. Love it. I'm so glad you're here. Thank you for bringing up some comments. I heard stress can also be a cause. So this is really interesting. As with most neurologic disorders, it's multifactorial, right? And in this particular study, they weren't looking at some of the other factors that could either be a cause or even a predisposing factor or something that could prolong dystonia or make it worse. And certainly the research and studies have shown that stress and anxiety and the environment and contextual factors can absolutely make dystonia worse. For sure. That's not what they looked at in this study. But they did look very specifically at the brain connectivity issues that have been, our understanding has grown a lot in this area for sure over the last just even few years, as they've looked at functional MRI. So not just your static MRI looking for brain structural changes, but functional, so they can look at connectivity between areas. Functional MRI, transmagnetic stimulation, another area that they've been able to use to find some potential changes in brain connectivity. So what is so cool about this study, though, is that for a very long time, our team has worked with dystonia for a really long time. We've done some great collaborations with Dr. Allan Wu at Northwestern. Now he was at UCLA. He works with a lot of people with dystonia. And we've always worked right alongside our neurology counterparts, the neurologists, the movement disorder neurologists that treat cervical dystonia, and have found a really great benefit when PT can work alongside neurology with medical management, which includes botox in terms of cervical dystonia. Botulinum toxin to the dystonic muscle can actually be very helpful in terms of cervical dystonia. And I'll show you some of the responses in the study with Botox. And when we were first doing this, so maybe this was 10 or 11 years ago, we would talk about it, and we just kind of hypothesized that it seems like when somebody does get Botox for cervical dystonia, it seems like there's this window of opportunity for neuroplasticity, for brain changes. And I can remember talking to Allan Wu and saying, yeah, like, I wonder, you know, if the muscle has decreased activity, right? Because that's what Botox does. If the muscle has decreased activity, what is that doing to the brain? How is that changing the brain? And how is that allowing the person then to improve their function and their movement? Not just peripherally. So it's not just that the muscle has weakened, but that it's actually driving changes in the brain. Nakia says, wow, right? Yes, wow. So really, really interesting. And so we hypothesized that there would be some sensorimotor changes happening in the brain after Botox. Same thing that we hypothesized to happen with therapy, by the way. And sure enough, over the last few years, they have been investigating this. Not me, not Allan Wu, but loads of other researchers have been investigating this and indeed finding brain changes after the Botox treatment. Now, we shouldn't be surprised because our brain and our body are not disconnected, right? We know very well that when we do something peripherally, that it's going to make changes centrally in the brain. Like that, of course, is going to happen. But what exactly happens in dystonia actually helps us understand dystonia as well. So this is what is so cool. So let me share a different piece here. What I wanted to show you was, as usual, super helpful to know who is this group that was getting, that was a part of the study. By the way, this was a retrospective study and actually has a pretty large cohort of people with cervical dystonia. Dystonia is not super common, and the fact that they had 78 people, really fantastic, and that they could compare it to healthy controls as well. They had a group of people with healthy controls, and what you can see here, although it's kind of tiny, I have to get myself up close, you can see that the number, so they did a male-female breakdown, their age. By the way, this study was done in China as well, so this is not a US-based study, their education and so on. And you see something here called the SUI score. This is not a score that I typically use for cervical dystonia, but they do use it in China, and it's similar to a portion of the Twisters score. So if you've ever done the Twisters of Toronto Western Spasmodic Torticollis scale, the SUI score is similar. It actually looks at the amount of control and movement that the person has in their neck and shoulders, which are most impacted by cervical dystonia. So this was their kind of symptom scale for the cervical dystonia. And what you can actually see here is a pre and post treatment, a pretty significant difference in that score. And so this was just looking pre and post Botox. And this was the first round of Botox for people. And these were folks that had, were not on other medications, did not have another diagnosis and so on. So it was very, I want to say, I guess, like pure group of cervical dystonia, not with other movement disorders and things like that. So always good to know who did they actually study, right? So this gives you some of that information, and you can see that the Botox was helpful. We know that in cervical dystonia, particularly with a good movement disorder neurologist targeting the right muscles, and I would say a movement disorder neurologist who's closely collaborating with their PT or OT colleagues to help direct that Botox treatment. That's what I love about working with the great neurologists that we work with here in the LA area, and Dr. Allan Wu in Chicago. We're still collaborating with him for patient cases. So when we work together, we can actually make recommendations like, this is what I'm seeing here functionally. I'm recommending these muscles. And I think that really helps people get a great outcome. But let's go a little further into the point of the study was not just to show that Botox was effective. We already know that is the case in cervical dystonia. What they wanted to see is what happens in the brain. Now, I am not an fMRI expert. I don't go looking at these and reading voxels and all of these methods all of the time. So that's my disclaimer. I will not claim to do any of that or even be able to interpret all of that, but I can show you some of these results. So I'm going to give you these little bar graphs first. So there's lots of little abbreviations on here. So this is looking at the connectivity in different parts of the brain. So in the, I'm going to have to get my key here so that I can look at it bigger. In the very first bar graph, we have the superior frontal gyrus, SFG on the right side, SFGR. And then we have the dorsal medial prefrontal cortex. So that's in the first graph. What you can see in the gray is the person with dystonia pre-treatment. In the dark, kind of purpley blue, is a healthy control. No, I'm sorry, I got that wrong. Gray is the healthy control. So sorry. Gray is the healthy control. Blue purpley is the person with cervical dystonia pre-Botox. And then that light lavender is the person post-Botox. And it's very clear there, and you can kind of see this across the board through these graphs, is things change with Botox, things change in connectivity, and in particular, that superior frontal gyrus, that's part of our premotor cortex, it's restored to the same functional connectivity that you see in healthy controls when the person has Botox. So interesting. In the graph on the right, so let me get this graph here. We see 3 bar graphs as well, and let me get the actual reading for that one. So this is B. So this includes our post-central gyrus, and oh, there's one more. Sorry, so many, they make these like really hard to read. Yeah, so holy awesome, Kia says, yeah, Nikki, the lavender represents after Botox. Yes, so holy awesome, isn't this really, really interesting that we can see this restoration in the connectivity after Botox? And again, this is for idiopathic cervical dystonia, no other diagnoses. And this is a retrospective, just looking at their functional MRI imaging. So I want to share with you this little paragraph here that really summarizes those results. So first thing first, and I think this really gets at the underlying pathophysiology and what we as healthcare providers need to think about when it comes to treatment, that patients with cervical dystonia have, in this study, elevated baseline connectivity. So increased connectivity of the right post-central gyrus with the left dorsal medial prefrontal cortex. So let's take a little brain here. These brains are not anatomically correct. I do have an anatomically correct brain here, but this is going to get us pretty close. Post-central gyrus, we have a gyrus kind of down the center. Post-central gyrus is our sensory cortex, and the front is more of our motor cortex and motor planning. So there's this elevated baseline connectivity between that and the right caudate nucleus is part of our basal ganglia. And that connectivity is actually associated with severity. Very interesting that it's associated with severity and correlated with severity. What they found was the Botox actually reduced the excessive connectivity. So this is something that's really important to think about with dystonia, is that, and this goes along with what we really understand from the pathophysiology, is that there is excessive connectivity, more connection, more excitement, less inhibition. And that's why we're actually seeing excessive movement in cervical dystonia. So, what we see in Botox, and this makes sense, is that it actually reduces that. That makes sense because we're reducing some of that excessive connectivity in those sensorimotor cortices is really what they are. It's reducing some of that connectivity, and it's doing that by decreasing some of that muscle activity that is happening. So it makes so much sense. Now, what they also found is that this reduction in connectivity also was correlated fairly well with the person having improved control of their head and neck, which is awesome. That is exactly what we want to see in cervical dystonia, and that is indeed what they saw. I wanted to read you one of the quotes here. I highlighted a bunch. I highlight a lot when I'm reading. So they said there's this partial normalization, so it's not completely normal, partial normalization of the disrupted functional connectivity in the sensorimotor integrative network with just a single dose into the dystonic neck muscles. And particularly, like I just showed you in that diagram, it was the connectivity between the premotor cortex and the sensorimotor cortex. And this was correlated with improved control, improved outcomes. So Nikia, in this study of people with idiopathic cervical dystonia, because by the way, Botox, not as helpful in some of the other dystonias. In this study, they found that if there was a particular muscle, and this is the really nice thing with idiopathic dystonia that's different from other dystonias, by the way. In idiopathic cervical dystonia, you have a very distinct, repeatable pattern in specific neck muscles. And I work with a lot of different types of dystonia, and that's not the case in other dystonias. So for example, functional dystonia doesn't have this repeatable specific pattern in a neck muscle that you can then target with Botox, right? So if you have a variable pattern, you can't target one muscle. And there is something very unique in cervical dystonia as compared to other dystonias. And by the way, I don't do Botox, right? I'm not a neurologist. I'm a physical therapist. I don't do Botox, but Botox is not without side effects, right? So especially in muscles around the neck, sometimes that can cause weakness in swallowing for a person. So this is not something that people take lightly, is to get Botox. But in this study, in idiopathic cervical dystonia, they did find neuroplastic changes after Botox. Now, I don't want this to be like, okay, let's all get Botox. That you know me, and I'm not a person pushing medical treatment, but I will say, in my experience in idiopathic dystonia, the combination of therapies plus the medical management has been very powerful for people. And particularly in cervical dystonia, I highly recommend people link up to a great movement disorder neurologist, and then I can collaborate with that movement disorder neurologist about the dosing and the placement of that Botox so that that person can have the best functional benefit. And that is definitely what we've found. We've shared some stories this week as we're preparing. Here, I'll get rid of this. piece, as we've been preparing for our mini course, we've been sharing stories of different people that we've worked with cervical dystonia that have had a great result with our intensive program of PT/OT psychology. They may also be getting Botox, right? And we may also time our therapy with the Botox so that they can have the benefit. Because if you imagine, and sometimes this is medication too. This has been seen in 3PD, for example. Medication or Botox may actually kind of open a window for neuroplasticity to take place. What's really cool in the study is it kind of showed that window opened. That would be prime time for therapy, right? So that is what I usually recommend for people when they have cervical dystonia and they're getting Botox management. Let's time therapy right with that. So typically it takes 2 to 3 weeks to really see that full effect of the Botox. Let's time therapy with that, maximize neuroplasticity. And get a greater benefit. And that has been shown in the literature, by the way, a greater benefit for folks with dystonia when, with cervical dystonia, when they have therapy plus Botox, much greater improvement in function, control of their neck when you have the combined. No surprise. And as Akia says, that's awesome. It is awesome. It's awesome to know that we can impact a person's life. We can make changes. We can utilize a window of neuroplasticity. By the way, Botox is not the only thing that can really open up windows, right? So it can be medication. It can be just getting sleep. It can be lifestyle and psychosocial changes that open up that door and that window of neuroplasticity. It can be exercise. We see that in the literature over and over again, in Parkinson's, in people post-stroke, and many other MS, many other diagnoses. Exercise and even aerobic exercise, literally right after the exercise, we have more BDNF in our brain, which is a neurotropic factor that drives brain changes. So yes, we are talking about dystonia. Yes, we're talking about this really fascinating study looking at the functional connectivity and the changes with Botox. But this is not an isolated piece. As Nakia says, also, sleep is tricky. Yes, these things that support our brain health, they're not easy things, right? Sleep can be really tricky. Our diet and healthy eating is not easy. Exercise, not an easy piece, especially if you have things that prevent you from exercise. Stress management, life and environmental factors, things that we can't control, like Nakia, like understatement of the year that these things are not easy. And that's why I think having a team approach to support a person is so important. And I think for healthcare providers to understand all of these factors that go into kind of opening those doors or windows for neuroplasticity so that people can have real, true changes in their brain and their life. I think this is so important. That's why we're doing a course on it. And that's why I'm sharing this all the time is I want to share what we're learning and doing here with the world for other healthcare providers so you can make a difference for people. So if you are a healthcare provider and want to learn more about dystonia, we're hosting a course next month. We're getting it all in: assessment, treatment. Chelsea Richardson and I are putting together this course. She's already put in just so many great videos of examples of assessment and treatment, sensory, autonomic, motor control, psychosocial, lifestyle, for focal hand dystonia, for cervical dystonia. We're working with Parkinsonian dystonia. So many different cases and examples so that as a healthcare provider, you can just take it and run and have some really great success with dystonia. That's what we care about. So thanks so much for joining me today. And again, we made it an oopsie on our early bird sale. So, Patrick, hey, thanks for joining me. We do have an early bird rate for our dystonia course, and it expires today. It was supposed to be yesterday, but we kind of messed up on that yesterday, and it accidentally expired too soon, so we gave it a whole another day. Yes, free continuing education for you, Patrick, and for the world. Literally every week I'm hopping on here just sharing what I'm reading and doing, so this is just free education for you all, and honestly, I just appreciate you all caring and wanting to grow in this area too. So thanks so much for joining me. Nikia, I see your question about myoclonus too. So to be continued, we'll have to have another talk about myoclonus. So much good stuff. You know what? What a great way to spend Friday with you all. Thank you so much. Dystonia guide today. Great question. So if you're looking for more dystonia resources, one, if you're a healthcare provider, join our mini course. It's next month, but you can sign up today. It's at reactiveeducation.com/dystonia. You can sign up for that. If you're looking for some dystonia resources, if you actually go to our webpage, reactivept.com, we've got a great blog post on cervical dystonia assessment and treatment. So you can go to reactivept.com and then click on our blog. We've got a blog post. We've got some resources there for you. We want to help you get started in helping people with dystonia. We feel so strongly that neuro rehab can be so incredibly effective in dystonia, and we want to empower people to have a way to do that, to help people with dystonia. So again, reactiveeducation.com/dystonia to get our mini course. And I hope to see you there. Thanks so much for joining me today. Have a great Friday and a wonderful weekend. And I will see you soon. Thanks so much.